I am standing here representing...
Speaking during the Kenya Kwanza Health Agenda and what his government will do if they win in August polls, Deputy President William Ruto noted that the health sector desperately needs a revamp, noting that the country must sort the health commodity supply chain. Ruto is proposing to strip the Kenya Medical Supplies Authority (KEMSA) of exclusive rights to sell drugs and medical kits to county and national health facilities should be he elected president in the August 9th elections.
As you've heard, 30% of our population are one sickness away from poverty.
Speaking during a Kenya Kwanza Alliance forum with stakeholders in the medical sector, Ruto, who is seeking the presidency under the United Democratic Alliance (UDA), affirmed that the structure of the supply of drugs needs to be redone in order to give counties a free hand to choose suppliers for drugs and medical kits.
Why we have a facility that don't have drugs that are required at the right time, but they have drugs that stay in the stores until they expire.
Could we continue letting those who can afford private care use private facilities and leave the public facility for those who would prefer to have a publicly funded system in the beginning until we look at a more national system?
If you have the Health Service Commission, as we have been saying before, of which if we can get our salaries on time, statutory deductions can be paid on time, and there's a system where health workers can work across the country seamlessly.
The DP further pledged to revisit the controversial 4.7 billion shillings tender to digitize Kenya's healthcare system, which was thrown in limbo after concerns were raised over the government's procurement process.
We can reduce significantly the cost of deploying our health by making sure that health records are available. We just need a mechanism, and it is not rocket science, because it's done by other countries, of making sure that there is health records confidentiality.
Let's get the licensing right, and we start selling digital health services, not only for export, but it'll also help us with the electronic medical records that you've been talking about.
According to DP further, majority of Kenyans are forced to seek services in level 4 and level 5 hospitals as they are unsure about the quality of services and medicine availability in smaller hospitals, in the process affecting delivery of services.
The health center is not working because there are no drugs. The dispensary is not working because there are no personnel. And the level 4 and level 5 are not working because there is congestion. Everybody is crowded there.
Close to 90% of our funding are done to the higher facility, that is the level 4 and above. So the level 3, level 2 and the 1 are left to vendor, or rather to actually work doubtedly without even the people who relies on them trusting them.
Faith Anyula, K24 TV.